Another challenge is ensuring that those affected by chemical weapons receive the support and assistance they need in a timely manner. This can be particularly challenging in conflict-affected areas, where access to affected populations may be limited or restricted. There is also a need for ongoing research into the long-term health impacts of chemical weapons exposure, particularly for survivors who may experience health issues years or even decades after exposure. This research can help inform medical treatment and support for survivors, as well as contribute to the development of new treatments and interventions. Furthermore, there is a need for ongoing efforts to prevent the use of chemical weapons in the future. This includes ongoing monitoring of chemical weapons stockpiles and facilities, as well as efforts to prevent the acquisition of chemical weapons by non-state actors. In addition, there is a need to raise awareness about the impacts of chemical weapons and the importance of providing support and assistance to those affected. This can help to reduce stigma and discrimination towards survivors, and ensure that they receive the support and assistance they need to recover and rebuild their lives. Another important challenge is ensuring that communities affected by chemical weapons are able to recover and rebuild. Chemical weapons not only cause physical and psychological harm to individuals, but they can also have devastating impacts on entire communities, including damage to infrastructure, loss of livelihoods, and displacement. Efforts to support community recovery and rebuilding can take many forms, including infrastructure repair and reconstruction, economic support, and psychosocial support. These efforts can be led by a range of organizations, including government agencies, humanitarian organizations, and community groups. Infrastructure repair and reconstruction can be critical to supporting community recovery and rebuilding. This can include repairing damage to buildings, roads, and other infrastructure, as well as ensuring that communities have access to clean water and sanitation facilities. In addition, economic support can help to rebuild livelihoods and support local economies, providing a foundation for long-term recovery. Psychosocial support is also critical to community recovery and rebuilding. Exposure to chemical weapons can cause significant psychological trauma, not only for survivors but also for entire communities. Psychosocial support can include counseling and mental health services, as well as community-based interventions to promote healing and resilience. Efforts to support community recovery and rebuilding can also be linked to broader efforts to promote peace and reconciliation. Chemical weapons attacks often occur in the context of conflict or political instability, and addressing the root causes of these conflicts is critical to preventing future attacks and promoting long-term stability. Finally, there is a need to address the issue of chemical weapons stockpiles and the destruction of these weapons. Many countries still possess chemical weapons, and the destruction of these weapons is a complex and costly process that requires international cooperation and support. Efforts to destroy chemical weapons stockpiles can take many forms, including chemical neutralization, incineration, and burial. These efforts must be conducted in a safe and secure manner to prevent accidental releases of toxic chemicals and ensure the safety of workers and surrounding communities. International organizations such as the OPCW play a critical role in overseeing the destruction of chemical weapons stockpiles and ensuring compliance with international treaties and agreements. The OPCW has been instrumental in the destruction of chemical weapons stockpiles in countries such as Syria, Libya, and Iraq, and has played a key role in preventing the acquisition of Chemical weapons by non-state actors.